Today really is a proud and momentous time for our country. And today's launching ceremony represents significant progress in my government's mission to ensure full and affordable access to health care for all the people of St. Kitts and Nevis. As has been indicated before me, this is an important manifesto promise of our Team Unity government. And today my cabinet colleagues and I signal that national health insurance remains a top priority. Today, with this launching ceremony, we move one step closer to providing dignified care for all our citizens and residents throughout their lives. Today's watershed ceremony comes at a time when our Team Unity government is celebrating its 3rd anniversary with an extended week of activities under the theme, Opening Doors and Creating Opportunities through Service and Empowerment. My government's efforts to open doors to health care for the people of St. Kitts and Nevis will close the gap on health disparities, marking a landmark achievement for our nation and further advancing St. Kitts and Nevis's leadership in healthcare delivery. Significantly, my administration's historic and unprecedented move to open doors to universal health insurance coverage will close the life expectancy gap between the poor, the middle, and upper classes. Our national health insurance will help our people, in particular the poor in our federation, access care on a timely basis. For our Team Unity government, opening doors and creating opportunities mean empowering the people to make a difference by bringing their passions, their talents, interests, and skills to bear in building our nation's future. In order for us to accomplish this very important mandate, appropriate safeguard measures are needed. These measures include a strong social safety net to assist the poor, the vulnerable and at-risk families that are just one health crisis away from financial ruin. It is therefore necessary to introduce a financial risk protection mechanism in our health system. The sad fact is that way too many people in our country and in the Caribbean do not have private health insurance coverage. Many of the uninsured cite the high cost of insurance as the main reason. Unlike some civil service professionals and some private sector employees, many people do not have access to insurance coverage at their job. We want to change the situation by encouraging more people to get insured early, and we invite all employers to add insurance protection to the range of benefits available to their employees. I grieve when hearing heart-wrenching stories of the lengths that some people have to go when an unexpected health crisis befalls them. Some uninsured have had to depend on their elderly parents and grandparents to take money from their lifelong savings in order to assist in a health emergency. Many of our people who lack private health insurance have also had to depend on the charity of others to cover high medical costs at home and abroad, including airfare. And in his presentation before me, the Honorable Minister gave good examples of this. And I also want to join in the commendation to Mickey for his work of charity in this especially important area. Sadly, emergencies often develop after an uninsured person gets sick, or as we say colloquially, taken after years of ignoring health symptoms and going without routine checkups and basic preventative care. These are needless tragedies, seeing that such care can often avoid. These are needless tragedies, seeing that such care can often avoid worse health outcomes and prevent larger costs from happening down the line. We, as intelligent people, must elevate our own commitment to safeguard our health by doing all we can to keep ourselves in the best health condition. Team Unity is a caring government, and for us in the leadership, the health of our people must come first. A single mother must not be placed in the position of having to choose buying groceries or scheduling a mammogram the same day she feels a small lump in her breast. Her children will find no solace in knowing that she chose their comfort over her own future, especially during significant life events such as their graduations, wedding and births and christening, when she is not there to share in the joy that she had always dreamed of for them. We believe that no one should have to skip taking a potential life-saving scan or other procedure because of the cost. Neither should they have to declare bankruptcy because of an expensive illness. Above all, we believe that equal access to health care is a basic human right. We applaud the efforts of a young doctor, Dr. Andy Redman, a neurosurgeon, in giving back to his community, in investing in the first MRI service here in St. Kitts in 2016. We applaud the 450 persons who were able to use the facility right here and save themselves the cost of traveling to and accommodation expenses related to overseas travel and care. We encourage more persons to follow the example of Dr. Redman and to set up more entities here which can provide specialist health support to our people right here in our federation, thereby bringing efficiency, effectiveness, and efficacy in healthcare delivery. It was Winston Churchill who said, "Healthy citizens are the greatest asset any country can have." It is therefore unsettling that the prevalence of non-communicable diseases has increasingly become a liability on the national ledger, with NCDs accounting for approximately 83% of all deaths in the Federation. What's more, NCDs, which include cancers, cardiovascular diseases, diabetes, and chronic respiratory diseases, continue to gain strength as the leading cause of death and disability among our people. These are preventable, premature deaths and disabilities that disrupt economic productivity, devastate families, and debilitate the country's human capital and development. These are preventable, premature deaths and disabilities that occur especially among the poor and whose impact is felt hardest in the CARICOM region. Concerned about the troubling trajectory of NCD statistics, it was then Secretary General to the United Nations, Ban Ki-moon, who prepared a report way back in 2011. That report is titled Prevention and Control of Non-Communicable Diseases. In it, he said, and I quote, "The ultimate protection for people at high risk or who already have non-communicable diseases is universal health insurance coverage. I want to repeat what Ban Ki-moon said. The ultimate protection for people at high risk or who already have non-communicable diseases is universal health insurance coverage. A significant factor in the unequal distribution of such diseases in low and middle income countries is the lack of public or private health insurance. Universal social protections must be on the goal. End of quote. You put then into context what we are attempting to do. Like the rest of the CARICOM region, NCDs are prevalent, and we are attempting to find a partial answer at least through the national health insurance. Indeed, if we were to follow the reasoning of Ban Ki-moon, it is the only response that is left to us. The government then ought to be congratulated for doing the right thing. According to the World Health Organization's data, in 2015, non-communicable diseases were responsible for 70% of global deaths. That is 39.5 million deaths. And over 3/4 of the NCD deaths, that is 30.7 million in 2015, occurred in low and middle-income countries, with about 48% of all deaths occurring before the age of 70 in these countries. Even more disturbing, the World Health Organization's 2010 Global Status Report and NCDs notes that nearly 30% of NCD-related deaths occur under the age of 60. People can die very young then. Additionally, a 2011 World Economic Forum study by Harvard School of Public Health economist David Bloom states that the cumulative cost of NCDs in low-income and middle-income countries during the period 2011 to 2025 will reach nearly US $500 billion per year, largely due to lost productivity from affected people who are in the peak of their work lives. Now, this is a sobering statistics. We are talking about $500 billion a year being predicted as a result of lost productivity from people affected in the peak of their work lives. So this is a matter then that has ramifications beyond government. This is a matter then to which the private sector must truly partner with us to ensure that we can bring resolution to this matter. This is a matter for which the religious community must be engaged. And this is a matter in particular which our education sector must pay particular attention to in the devising and implementation of our school curriculum. 2 of the 5 key messages that emerge from this World Economic Forum study, titled The Global Economic Burden of Non-Communicable Diseases, are that middle-income countries like St. Kitts and Nevis and many others in the Caribbean are expected to assume an even larger share of the economic burden of NCDs as their economies and populations grow. And cardiovascular disease and mental health conditions are the dominant contributors to the global economic burden of non-communicable diseases. That is why on Tuesday, at the renaming of the Mental Health Treatment Center, to reflect Dr. Arthur W. Lake's contribution to the psychiatric field, I pledge that my government will work to ensure that our own brand of universal health insurance plan considers our mentally ill by forbidding the exclusion of people with pre-existing illness from gaining medical coverage. Indeed, our national health insurance system, health coverage will be provided from the cradle to the grave, and it will cover all persons regardless of age, employment situation, income, or pre-existing conditions. My government has taken this progressive step forward because people matter most to our Team Unity administration. We understand the pain of our people, oftentimes traumatized by the sheer costs of health care. And I believe this was very well ventilated by the cases of real people, real suffering, enumerated by the minister before me. 20 years before Team Unity, the government of the day denied itself the opportunity to help our people. It is now the responsibility of Team Unity to step into the breach, and we will succeed where others before us failed to do the right thing for the right reason. For us, this is an urgent matter, and we are making steady progress on our health commitment. For its part, the Ministry of Health will continue the delivery of quality health services in the public and private sectors. And I want at this juncture to commend the efforts of our Ministers of Health, the Honorable Jean Hamilton, for providing leadership in regard to planning the delivery of universal health insurance coverage, buttressed by his many years of experience in the insurance industry. The Senator with responsibility for health, the Honorable Wendy Phipps, ably provides support, and they are all backed up by our Chief Medical Officer, Dr. Hazel Laws, and her incredibly talented and hard-working staff in the Ministry of Health. Most importantly, there is incredible support across the public and private sectors to work together to achieve the best offering for our people, and the composition of the Commission indicates that. We are encouraged by the involvement of the experts at the Center for Health Economics at the University of the West Indies in assisting us in finding viable options to achieve our goal of universal national health insurance for all. In closing, therefore, may God bless our collective efforts, and may our people be persuaded to live healthy lives, remembering the adage, prevention is far better than cure. Our health is still our wealth. Indeed, financial costs of ill health can be ruinous. Today we are working to consecrate the future of our people and our beautiful country. And so I say onward and forward with a healthy nation, forward on with universal health care and insurance. May God bless us all. I thank you.
Stay up to date with news, programs, and activities of the government with SKNIS. Like us on Facebook. Listen to us on SoundCloud. Follow us on Twitter. And watch our videos on YouTube. Connect with us today. SKNIS, St. Kitts and Nevis Information Service.